Hello YouTube. I'm super excited this morning because today I'm heading to my first Rio clinical rotation. Now I said Rio because 3 weeks ago the rotation was at a home care facility and we just passively observed. Nothing was hands-on, and to me that's not enough. Today's a different story though. My boy Manny is picking me up and we're heading to the inpatient floor of a local hospital, basically to apply what we learned this week. We're going to be taking vitals, we're going to be taking patient history, and it's going to be fun. I spent last night practicing taking blood pressure on my brother, and now I gotta say, I feel a lot more confident with this skill. Let's get to it.
Don't you need my permission for this?
Stay out of the camera.
You don't have my permission.
I don't have your permission?
You don't have my permission.
Come on, give me your verbal consent right now.
You ain't getting nothing from me.
Real resume. Are we going to pick up Dave?
Yeah. Dark green, scrubs.
There's Farmer.
Asleep.
Hey, say hi to YouTube.
What's up guys?
Oh, by the way, do I have your permission to put this on YouTube?
Sure, why not?
There we go, guys. Done deal. Got his verbal
He
consent.
still doesn't have mine.
And it's documented. Dave, how excited are you?
Oh, I'm pretty excited. It'll be a fun experience.
Awesome.
Get to work with some real people.
I'm saying, don't forget to wash your hands, guys. Don't forget to ask the patient for permission to touch them. Manny,
What?
you got anything to add?
Oh, well, you know, Manny has one job and one job only today. Don't kill nobody, Manny. Stay safe.
Alright.
It's gonna be tough for you.
It's gonna be really tough for me because I don't have my food. I didn't bring any food.
Listen, I brought a banana just for you.
I didn't bring any food either.
Ay.
Wait, did you not eat or did you not?
No, I ate, but
Yeah,
that's
listen,
the
4 hours.
number one rule, man. Just
4
to
hours. You guys can survive 4 hours.
Wait, it's only 4 hours?
Yeah, 8 to 12.
Nice.
Yeah. Wow. Listen, if I could go, I would go. Yeah, I'm like, what the hell?
Manny, you know where we're going? Alright, this is where the footage is gonna end because for legal purposes we can't film what's going on inside. Alright. Later guys.
So once we got inside the hospital, we waited in the main lobby for the rest of our group to show up, and then we were brought into a conference room where for 30 minutes we just practiced taking blood pressure. Our clinical instructor came afterwards and took us to an available computer where she debriefed us on the patient we were going to see. Best part about it was the fact that our clinical instructor enjoyed answering our question and showing us around. You know, we didn't look like we were extra work on our schedule, which made the experience even better. I saw 3 patients, 2 with total knee replacement and the last one with a hip replacement. Best part was the fact that one of the patients with the total knee replacement had a knee spacer, and every time you'll go to knee extension, it will just clicks. We've never seen anything like this. But hands down to the patient with the hip replacement who, you know, after surgery had 0 pain. We're talking 0 pain after a hip replacement. Oh, the weather did get better on the way out. And in such nice weather, you know, I had to be a good classmate and get my people some camera exposure time.
How was your experience?
It was amazing.
Did you see anything fun?
Yes, we saw physical therapists being very efficient, very fast with their skills. We're gonna be there one day soon.
Hopefully so. Dave, Nothing?
What?
Nothing?
What do you want?
Anything.
That was fun.
That was very short.
Clinical rotation tips for you guys. Make sure you practice taking vital signs because you will end up taking vital signs once you get to the hospital. Make sure you eat before you go to your clinical rotation because the last thing you want is walk around the hospital floors and passing out from hunger. Be assertive and stay engaged, guys. You finally get a chance to practice some of the skills you learned the first 3 months of PT school. So once you get there, you really got to soak everything in. Lastly, enjoy every single second of it. PT school is challenging, but it's also a lot of fun, especially when you get to do things like this after a clinical rotation.